Hi, my name is Maria Gonzalez, and I went to Genoa Pharmacy in Gilbert with the P4 student Patrick Vaughn. I asked him a few questions while I was there, and for him, that to practice in that pharmacy setting, it felt very special because he was very close to others, like patients, unlike other retail and community pharmacies. So it is very, you work very closely with the patient and with the doctors and the nurses. So you get to know a lot more than just what retail shows. He did say that his typical day was usually filling prescriptions, doing bubble pads, bingo cards, voicemails, transferring some prescriptions, checking some orders, consult some patients, do some vaccines, even though that's not very common in the thing, and work on his midterm and final project, which are currently based on psych, schizophrenia and bipolar disorder. Again, for it's similarly for the pharmacist duties. They mainly the main difference is that they verify the prescriptions, so they're not only doing the filling, but they're also doing the verifying part of it, and they do mail all the patients their prescriptions because there is more mailing happening than in person interactions sometimes. And usually doesn't take any additional training to become a pharmacist under Genoa Pharmacy, even though it is in a clinic, but it's still considered a community pharmacy. For the most part, the P4 student does his midterms and final projects. He gets very familiar with the psych meds. Usually does the weekly bubble pads for the patients and fills prescriptions. He works. He shows up at 8 in the morning. Works till 5 p.m., which are the hours of the pharmacy, and typically also answer phone calls and transfers and works again on his project. The project that he's doing is based on schizophrenia and bipolar disorder, and he has to do a 30-minute presentation twice a year, well, twice a block, for his preceptor regarding that. And yeah, he said he would like to work there after graduation because of the patient demographic. He likes working with them and helping them, and he also felt like the environment and the company and at the pharmacy get just felt like it was a good work environment. For the most part, the advice that Patrick did give me was before asking questions, like to ask a lot of questions if I had them, but before asking the questions, to make sure to figure out the answer before asking the questions. Only ask the questions when it is completely necessary to do the like when you absolutely could not find the answer to the questions. To try to learn as much as possible, make sure to show up on time. He also told me about this one P4 student that failed their rotations because they just didn't get along with a preceptor. So he said to try to get along with a preceptor and avoid arguments when you can. I would love to do a rotation there. The environment, the people just felt good to work with, and it just felt like it would be a good match for me. Thank you.